wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to the program today. I have with me one of our key staff members, Lesia Dubriel, and Lesia is our radiology technician. She runs and operates two pieces of equipment that we use for diagnostic studies here at the Hotze Health and Wellness Center, and that would be the EBCT scan, which is an electron beam computer tomography. It's a heart scan. We check your heart to see if you have any calcification of your arteries. And then we also have a DEXA bone density machine, and that measures the amount of calcium and the strength of your bones to see if you have any osteoporosis or osteopenia, or whether your bones are strong or not. And this is what Lesia operates here at our center on our guests. So the first thing we'd like to talk about is computer CT scans. Why don't you tell us what we have down there and why the system that we use is safer than other scans that other people use?
Here at the Hotze Health and Wellness Center, we use the EBCT C300 scanner, which is a Imatron product. This scanner is specifically used for heart scan imaging. It was specifically produced for heart scan imaging. This is going to be the scanner that's going to give you the lowest dose. There's nothing else out there on the market like this. It's going to give you
the lowest dose of radiation.
That is correct.
It's 1/10 the dose of most other CT scans.
That is correct. And it's going to give you optimal imaging in one of the fastest amount of time of scanning possible.
How long does it take for somebody to, once you put them on the scanner, how long will it take?
On table time is about 3 or 4 minutes. The whole time you're going to be with me from intake until I say goodbye is about 10 minutes.
And it's important to do CT scans because it tells us about your coronary arteries, determine whether or not you have coronary artery disease. It measures calcium in your coronary arteries. So obviously the best rating would be 0. You want to be low, no calcium in your arteries. But this measures calcium in your arteries so we can see whether or not you have no, minimal, mild, moderate, or severe atherosclerosis. That's hardening of the arteries or the atheroma. And what causes this is inflammation in the arteries. When the arteries become inflamed, the body wants to heal the arteries, or else the arteries would become they would deteriorate to the point that they could break open, and the body doesn't want that to happen. So it wants to heal the arteries, and the way the body heals the arteries is it absorbs lipid protein molecules that carry cholesterol, and they bind and patch like a Band-Aid. They patch the arteries. And then in order to harden the artery so it doesn't break apart, it absorbs calcium. So this is the body's mechanism, a backup mechanism. If you have inflammation in your arteries, the body wants to heal it so the arteries don't break down or deteriorate. The problem, which is a good backup mechanism, the problem is if you continue to have inflammation in your arteries, the arteries become more narrowed, and then you can throw a plaque off and plug up in one of these hardened arteries, and that leads to a heart attack. So what this particular scan tells us is whether or not you have coronary artery disease and how bad it is. Then, if you don't have any, that's good. And you need to continue to stay on a lifestyle that would prevent you from developing coronary artery disease. Primary cause of coronary artery disease would come from bacteria in your mouth, in your teeth. If you've had a nerve root, bacteria can grow in that old tooth, and that every time you bite, that sheds and goes out. If you have inflammation in your arteries, that can bind, those bacteria can bind and cause inflammation in the arteries. Another thing that causes inflammation is if you have metal that you're exposed to, for instance, mercury in your teeth or aluminum, maybe from your cooking appliances, this metal gets into your body and it will inflame the arteries. Another thing that will cause inflammation is a high sugar diet. All these cause inflammation. And ultimately, they will lead to hardening of the arteries or atherosclerosis. And that can lead to coronary artery disease, and it can lead to strokes. It can lead to kidney disorders, a host of health problems. And that's why we think it's very important for you to get a baseline study, probably between the ages of starting at about 40 years of age. Get a baseline study, see what your coronary arteries look like. If you've got hardening of the arteries, you need to prevent further deterioration of your arteries, further inflammation, and you've got to go on a good, healthy eating program. And what does that mean? Well, that means you got to cut out your sugar and your carbs, just eliminate it altogether. You've got to detoxify your body. Our bodies, that's another thing that causes inflammation in the arteries, is all the petrochemicals, pesticides, insecticides, hairsprays, all the chemicals that are in the packaged food, all these inflame the arteries. You've got to eliminate that and go on a detox program by, one, eating organically, and secondly, by detoxing your body. And we do have detox products down in our vitamin store that will help you detox. That's very, very important. Another thing that's very important is vitamin C. Vitamin C stimulates collagen production, and that's the protein that will line your arteries. And so vitamin C is very, very important. I recommend 1,000 milligrams of vitamin C per 25 pounds of body weight. And so weigh 150 pounds, take 6,000 milligrams a day in divided doses, 2-3 times a day. Vitamin C has a 2-hour half-life, 12-hour full life. So you want to kind of keep your vitamin level over the day at a certain level. So the best thing to do is to take it 3 times a day in your doses. Vitamin C is important, and vitamin D is very important for heart disease as well. So you want to take high doses of vitamin D, minimally 10,000 international units a day. You want to get your levels up to at least 90 to 100, at least. Those that study vitamin D long-term and believe in high-dose vitamin D believe you can take it up to 120 or 150 nanograms per milliliter. And I think that's very important. That helps protect not only against coronary artery disease, but it also helps protect against osteoporosis, we're going to talk about in a minute. And it also helps stimulate your immune system, helps prevent cancer and infections. So these are some things you can do to prevent coronary artery disease. And we want to encourage you to do that. So we'd encourage you to come in and have Lisa run the scan on you, and let's get a baseline. Now, some people ask, do I have to be a guest at the Hotze Health Wellness Center to get a heart scan? No, you don't, but you do have to have an order from your doctor, because when we take this scan, we have to be able to send it to somebody who's going to manage your care and make some recommendations. So that's the story on heart scans, and that's very important to do baseline heart scan.
And I just want to say the scan is non-invasive. There's no prep involved. It takes all of about 10 minutes. Excellent to get in and get a baseline. Know what your stats are early in life. That 40-ish year age range is excellent time to start looking into screening exams.
And the other thing we get with the heart scan, it happens to do the lungs as well.
That is correct.
So we send these scans off to a radiologist who reads them and gives us and we get the score back. We'll get a score back pretty quickly from the machine. Computer will print out a score on the calcification and how much atherosclerosis you have. But the radiologist will also read your lungs and any other things that show up to see if we have any other problems going on. So I encourage you to do that. Thank you so much for visiting with us about the heart scan, Lisa.
My pleasure.
And thank each one of you. If you would like to have a heart scan and you're a guest of ours, be sure to call up the office and schedule it next time you come in. If you're not a guest, get an order and we'll be glad to do it here for you. I'm Dr. Hotze. Thank you so much for joining us today.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.